Okay, now if you have a 42-year-old female
Mhm.
with a breast lump,
Okay.
okay, so this is what I want you to do. What's your differential if there's a breast lump?
She's
Okay,
42.
yeah, so it depends on the physical exam. Okay, if there is, so what are the features of, there are features of benign, there are features of malignant. If malignant, if they say hard, immobile, irregular, size more than 2 cm, lymphadenopathy, okay, there are, this is malignant.
Mm.
Okay, but if it's mobile, regular borders, less than 2 cm, okay, the other criteria is benign, okay. However, so we have differentials, okay, it could be fibroadenoma. This patient have a benign features,
Okay.
okay, okay. So you do, it could be fibroadenoma,
Mm.
fibrocystic changes, it could be intraductal papilloma,
Yeah.
could be fat necrosis, it could be duct ectasia. Okay, so this is those are the options that could be. However, the age is old. Okay, 42-year-old. Like it's kind of scary. So we have to do something about it. So what do we start? The first thing we start with ultrasound and FNA. That's an important
What,
thing. And
what
then,
about
hmm?
can we do mammo first in a 42-year-old?
Yeah, you can do mammogram too. That's an yeah, that's a good note too. You do a mammogram. Okay,
Okay.
what's going on? Mammo, okay, plus ultrasound, and then you look at the finding of ultrasound, okay?
Mm-hmm.
Okay, if it's simple cyst, then you don't need to do FNA. However, if it's complex, okay, then you do FNA. Okay,
Okay.
when you do FNA, then it could be multiple options. It could be cystic or it could be solid.
Right.
Okay? Now, if it's cystic, then it could be two options for cystic. Okay, let me put it in numbers here so that make more sense. Okay, so if it's cystic, it could be either cystic bloody or it could be cystic non-bloody. So how do we manage each? If it's cystic or bloody, what do we do?
If it's bloody,
Yeah, we do
and
excise if cytology positive.
right.
Okay. How about if it's not bloody?
Mm,
Hmm? Re-
same thing.
reassure and repeat exam in 4 to 6 weeks.
Okay.
Okay. If it's recur, then surgery. Okay, cystic non-bloody. Now the second option is that if it's solid, okay, if it's solid, then it could be two options. Either it's malignant or it could be benign. If it's malignant, just excise. If it's benign, then you do mammogram if more than 30 years old, like this patient. Okay, and then depend on the results of the mammogram. If the mammogram is negative,
Mm.
then you repeat exam in 3 to 6 months. If the mammogram positive, okay, then you do additional imaging like MRI and stuff, and then you excise,
Mm.
okay, if it's malignant. So those are the important stuff. There are monitoring. What are the things that we need to monitor? We need to follow up, okay, Q3 to 6 months for 1 year for these types of patient. If there's these types of issue, and so outpatient management, and there are the timing. Mammo and FNA should be ordered immediately. Okay, and reassurance on next visit if the mammogram is reassuring. Okay, not the first. So those are the things that you should keep in mind. So in a nutshell, just to summarize, breast lump, we do mammo, ultrasound, FNA, and cut the glean. You can do them, routine stuff.
Mm.
If it's simple, reassure. If it's complex, you do FNA. If it's
Yeah.
cystic bloody, excise. Cystic nano-bloody, reassure. If it's malignant, excise. If it's benign, mammogram, if more than 30 years old. If the mammogram
Mm.
positive, you do additional imaging. Okay, but if it's negative, repeat exam in 3 to 6 months and reassure.
Mm.
Okay, period.